Newly released figures show more Oklahoma babies are making it to their first birthday, but the state's infant mortality rate remains high, especially among minorities. With September being Infant Mortality Awareness Month, state agencies are heavily pushing initiatives to educate new and expectant mothers, hoping to keep more of Oklahoma's children from dying so young.
It is my first pregnancy.
Melanie Bays recently discovered she's going to become a mother next year. She's excited, but also surprised by the amount of information she's had to absorb.
There's a lot to learn, and so I've been having to read a lot of books and get on the internet and talk to my doctor about various topics, so that's been new.
Helping her to keep track of everything is a free text messaging service called Text for Baby, which provides pregnant women and new mothers with health information.
I get 3 messages a week. They are everything from, local resources like how to install a car seat, reminders about immunization and prenatal appointments. That's something I'm really hooked into and I'm checking every day.
Darren Kirkpatrick is Health Promotion Manager for the Oklahoma Healthcare Authority. She says Text for Baby is a nationwide initiative that began 3 years ago. Last year, Oklahoma became one of only 4 states to be involved in a pilot program to customize the information.
So if a mother indicates that she's on Sooner Care, then we'll actually highlight Sooner Care specific benefits, which is really great. Also in Oklahoma, we have Oklahoma specific resources such as the Oklahoma Tobacco Helpline or the Milk Line or the Breastfeeding Hotline, things like that are more specific to Oklahoma.
New or expectant mothers can sign up by texting the word baby to 511411, or they can sign up online at textforbaby.org. Kirkpatrick says the program has been successful, with about 3,500 new or expectant mothers already enrolled.
The goal of this initiative is to really improve health outcomes for pregnant women and babies.
Oklahoma has historically had one of the nation's highest infant mortality rates, although the state has seen some improvement. The number of infant deaths per 1,000 live births has dropped from 8.6 in 2007 to 6.8 in 2013, but the gains are not spread equally across all ethnic groups. While the 2013 mortality rate for white babies was 5.7 per 1,000 live births, the mortality rate for black babies was nearly 3 times higher at 16.5.
So we know that we need to look at that further, understand better what's going on and why those disparities exist, and then continue to implement strategies directed at those high-risk populations.
Jeanette Klein is a maternal and child health consultant with the Oklahoma State Department of Health. Klein says the agency is promoting the Preparing for a Lifetime, It's Everyone's Responsibility initiative to educate women about healthy outcomes for themselves and their babies.
We encourage women to be at a healthy weight, to plan their pregnancy, to take multivitamins with 400 micrograms of folic acid. That helps to prevent birth defects, to manage chronic diseases that they might have, such as diabetes or high blood pressure.
The agency is also spreading the word about the risk of premature births. In 2012, Oklahoma ranked 44th in the nation in the percentage of babies born prematurely. The health department hopes to lower that number through the Every Week Counts collaborative to discourage elective deliveries before 39 weeks.
After 39 weeks, your risks are much less for many complications. Babies can develop lung problems. They can also have difficulty with vision and hearing later in life.
We've worked very closely with hospitals over the past several years so that they put policies in place so that there is not induction or a C-section scheduled prior to 39 completed weeks of pregnancy without a medical indication.
Klein says they've had great success with the initiative. Since January of 2011, there's been a 94% decrease in the number of early elective deliveries in Oklahoma among participating hospitals.
If you can, wait for it. Don't rush it.